The Greater Virunga Landscape is abundant with both terrestrial and aquatic resources, boasting of rich biodiversity, including species that are endemic and endangered, shared between Uganda, Rwanda and the Democratic Republic of Congo.
The Greater Virunga Landscape is arguably the highest concentration in the whole world of biodiversity, which biodiversity actually means the life forms.
However, this has made the landscape susceptible to pandemics and other disease outbreaks due to the free movement of people and the wildlife across the borders. This was the situation recently when the neighboring Democratic Republic of Congo reported an Ebola outbreak, prompting authorities in Uganda to step up surveillance and monitoring at the borders to control the spread of the disease. Now, as part of efforts to address the above, the Greater Virunga One Health program has been launched.
The Greater Virunga is recognized as a hotspot of infectious disease threats, Ebola, anthrax, Rift Valley fever, and more. And the ongoing Ebola outbreak in DRC is a stark reminder of the vulnerability and urgency of collective action. This project responds directly to the challenge.
The project, therefore, offers us timely opportunity to enhance information sharing, data sharing, establish joint surveillance, and mount coordinated responses during public health emergencies, as well as to have us be prepared at the same pace.
The country director of WWF Uganda, Ivan Tumuhimbisa, says the 3-year program aims to address the threats of zoonotic diseases in the Greater Virunga Landscape and build the capacity of governments and other partners to detect and prevent them.
And the idea is basically to build the infrastructure around the laboratories across the 3 countries, building the capacity of communities to understand and appreciate the threats, but also how can we work together to make sure we mitigate the diseases being transmitted between people and also wildlife. The entire program is budgeted to the tune of $25 million, and about 40% of that will be used in Uganda.
Launching the project, Deputy Speaker of Parliament Thomas Tayewa emphasized the need for collaboration among the states in the Greater Virunga Landscape to prevent and respond to pandemics.
So even where we fail to come together as politicians, where we are talking of political integration, the way the president has been talking about it, the animals are already integrated and the diseases are already integrated. They don't know about all this. So I'm really happy to see that we as human beings, we have also now been integrated. We've come together, DRC, Rwanda, Uganda, to tackle this very critical issue.
He noted the importance of prevention to avoid a bigger cost in response when the health emergencies break out, and the need to develop local funding strategies to sustain the program.
We would rather spend these billions early to prevent, even if only one person, even if we spend 100 billion and we save one life, that 100 billion will be worth it. But the problem is we usually wait, and then when we start losing people in thousands, it's when we wake up and we avail budgets.
Meanwhile, Tayewa has cautioned politicians against trading environmental conservation for cheap popularity during the campaign period.
National parks are not for looking for votes. No way. They are for protection, and it's non-negotiable.
Benjamin Jumbe, NTV Tonight.